Hello, everybody. Good evening out there in social media land. It is another installment of Medical Talk in Layman's Terms with Nurse Charlene. How you doing out there? Y'all come on in as I get ready to start. I'm just going to start with some introductions and a little bit of my commercial and everything. But yes, I wanted to come on in and talk to you guys on this podcast about a special viewers pick. That means one of my faithful viewers that has been on almost every single podcast since I started in beginning of March 2025 with Medical Talk in Layman's Terms with Nurse Charlene. This person picked this to talk about, and the subject is sarcoidosis or sarcoidosis. Yes, that's how it's pronounced. I get a little tongue tied, so you'll catch me stopping a little bit and everything, but I know what it is because I had to find out. Yes. So as I dive on into the subject this evening, I want to explain a couple things. Then I'll do my podcast disclaimer, and then I'm gonna go ahead and get into the meat and mashed potatoes of it, and everything. So first of all, I just want to explain that I started a series 2 Tuesdays ago called Back to the Basics. And so Back to the Basics was me looking at where I was going and everything, and what interested people and stuff on. And I wanted to make sure that I came with some good stuff for you. Like I like to talk about STIs. They used to be called STDs or venereal diseases and stuff like that, and get all into the little lingo and things like that. And so trying to keep you intrigued, but actually giving you a little nugget, teaching you a little something about it. So 2 Tuesdays ago when I started with diabetes, a complete overview. And then after that, I went on to hypertension. And before I go all the way into this and stuff, I just want to acknowledge hello, Pastor Mayfield or Pastor Carol and Auntie Josie. Hi, sweetie. And stuff. Welcome on in, you guys and stuff. Thank you for coming on in and sitting with your girl for a little while and stuff while we talk about this medical stuff that's so crazy, but actually is very simple. It's very simple. All of us got a body, and we all need to know what's going on in it and everything. Yes. Good evening, Pastor Carol. Yes. So when I'm getting into this and stuff, the biggest thing is I wanted to explain back to the basics and why I came up with that. And that was to make sure that I'm giving you the stuff that you really do need. And these are tools. Each subject is a tool. Diabetes is a tool. Nobody knows about it. And then there's hypertension and heart disease. Nobody knows fully about it unless you mess around and find out by getting it or having a heart attack or having coronary artery disease and getting stents placed in your arteries that feed the heart blood and stuff. You need to know those things so that you know why you're suffering and not to be quiet. It's always been snitching on you from the time you were born. It was snitching in the womb. Our bodies were snitching on us as babies, and it's so rare that we come up with the reason why our bodies is telling on us. They're telling. And what is telling? A snitch is a symptom. What is a symptom? A symptom is a fever. A symptom is a headache. A symptom is pain. A symptom is an infection, a cough, a runny nose, a stuffy nose, and stuff. Those are symptoms. Those are snitches. It's telling you, hey, you might have a cold. You might have COVID. You might have high blood pressure. You might have diabetes. Are you very hungry, thirsty, and what is it? Polydipsia, polyphagia, hungry, dipsia, and are you urinating a lot all at the same time? You might have diabetes. Do you want to catch it now at pre-diabetes or first stage diabetes, or do you want to catch it later when you're having a stroke or a heart attack? You see what I'm saying? So that's the reason why I'm on here doing what I'm doing and stuff, is to get you to a point where you can at least recognize it. You don't have to know every single thing, but I advise you to actually go back and look at some of the stuff. I try to keep it fun and lighthearted. I laugh a lot about things and stuff like that. But this is no joke. It's serious and it needs to be told. The story needs to get out there and stuff. I'm not playing with you and stuff. This is life threatening and, a life change and lifestyle things and stuff. And if you find out, it might not be so hard to be motivated to fix it and everything. So like I said, back to the basics, it's going to include some things like, we did diabetes, we did high blood pressure, which I'll continue to do that off and on all throughout, and heart disease. And then we got kidney disease. I'm going to talk about strokes, how to spot a stroke without having to be, 911 to spot a stroke. You can spot one on yourself. Being able to spot respiratory illnesses. That will include asthma and COVID and all the other things, pneumonias and, all those things and stuff. Your gastrointestinal or GI system, your gastrourinary, which is your GU system, and that's where you pee. Gastrointestinal is where you eat and you poop, and stuff. And knowing what those are and knowing the difference. Substance abuse and substance use disorders and stuff. Knowing that, yeah, you can actually be addicted to cigarettes, addicted to weed, addicted to alcohol, addicted to actual drugs, opiates, meth, crack, and stuff like that. Being able to explain marijuana in detail, explain eye diseases, and that, glaucoma is a group of different symptoms. It's not, I got the glaucoma, and stuff like I got the vapors, and stuff like that, that it's really a thing. Being able to explain nutrition and diet, and being able to look on the back of your label and know, oh, it got 3 servings in here. So if I eat all of these, I'm gonna have 800 calories, instead of eating 1 serving, which is this, and knowing what that is, and ear disease, that it's a whole little ear system. It got its own little ecosystem, and being able to deal with that. And then also mental health, that it ain't no joke. Oh, you bipolar. Oh, you got schizophrenia. That ain't cute, and stuff like that. So being able to explain that to people, and stuff, that schizophrenia is no joke. Bipolar is no joke. Depression is no joke, and stuff like that. Being able to describe sickle cell disease, and stuff for people, it's not a one size fits all. So I can't make it to where it tailors to one person or tailors to this person. It got to tailor to all, and you grab what you need out of it. And if you can't use it at the time, it's still worth a listen. You might be able to help your neighbor that you're not even related to, and different things. You might actually save somebody by accident, save them some heartache or something. Homelessness versus unhoused, and that it's really a thing to be called unhoused, not homeless. Ooh, them homeless people. No, the unhoused. And that's the new thing, like she and he and they, them and their, and her and him, or whatever they, and being able to explain those things and stuff, and that those are really mental health things going on also. And just having all of that stuff, to, explaining cancer again, so that it's not, oh, cancer, but oh, cancer, okay, we need to get on this, and stuff like that, instead of oh my God, they're gonna die, everybody I know, they died from it, and stuff. That's not positivity. Does anybody pray? If you, oh, how you know. But anyway, like I said, it's a passionate subject. I want to make sure that I cover all of that when I'm talking to you and everything and stuff. But also things like on here, I'm going to be introducing viewers picks, and that's when you have a subject that you really passionate about. You haven't heard me talk about it, or I haven't talked about it in detail enough and stuff like that, and being able to revisit that if I've talked about it already. But if I've never talked about it, like the one I'm talking about tonight and stuff, being able to get that out there and stuff, because you never know, it might not touch you. It's not going to touch me because I haven't had it, but that doesn't mean that it doesn't need to be said, and everything. So that's where this is all coming from. And then also, and that's the reason. And then also, when the viewer pick, I don't just go on there, girl, I'll do that next week, or something like that. No, it's a planned event. So what I do is I study it so that I'm giving you facts, not fiction, and everything. So that's where that comes in at. And then also, last but not least, having guest speakers. I've had several people that want to come on and speak their truths, and stuff. And sometimes it doesn't necessarily, as you'll hear in my podcast disclaimer, it doesn't necessarily are the exact views of me as the host, but sometimes it is. And I want you to get it out. And so, if we're gonna visit that and have little sections where I'll steer off from back to the basics, and then allow guests to come on, and we all learn together, so that we're picking it up from here, we're picking it up from here, we're picking it up, like where organics really originated, and why this is this, and why there's supplements. Oh, that's sea moth and Dr. CB and and all of that stuff, and really getting the truth about everything and stuff. So if you can imagine that, that's what's coming. That's the treats that are coming and everything. One last one that I wanted to make sure I get out before I read my podcast disclaimer is the actual testimonial. So we're gonna have some testimonial Tuesdays. I'll announce them way beforehand, where I'll have guests come on that's been through a real, trauma of some sort, whether it's PTSD, whether it's a cancer, whether it's, a heart attack from high blood pressure and whatever that led to and everything, and being able to come on and speak their truth. And you get to listen and know that it's not, this is not a judgmental platform, that we coming on here to learn from each other and keep that circle of education and life going and everything. So I just wanted to make sure that I got that spill out and stuff, because it's very important and why I do what I do and everything. So now I'm going to go ahead and read my podcast disclaimer real quick, and then I'm gonna get into the meat and potatoes of sarcoidosis. I said it. Okay. So the podcast is for informational and educational purposes only. It is not intended to replace professional medical advice, diagnosis, or treatment. Okay. Always consult with your physician for any medical concerns. If you have questions about a medical condition, reach out to a qualified healthcare professional. Never disregard professional medical advice or delay seeking it because of something you heard on a podcast. Guest views are their own and may not reflect the views of the host, that's me, or this podcast. Yes, that's me also. The information shared is for general knowledge. It should not be used for any legal or medical purposes, meaning I can't help you with your lawsuit, but if you're doing it in good faith, I hope you win it. That's right. Everybody else, they win theirs. Okay. Always consult a licensed professional who knows your medical history. I don't know your medical history, but always consult with a licensed professional who knows your medical history for a meaningful evaluation. And you guys, please stay informed, but always seek professional advice when it comes to your health. Professional advice. That means if the doctor went to school for 150 years, you probably should try to find out what they know and everything, because that's going to be the best thing for you. Not, this old remedy or that old remedy. If they work for you, okay, maybe you can slip through and stuff. But after a while, somebody going to have to go to the doctor. And I hope it ain't me. And stuff. But anyway, if I do, though, I'll be the first to tell. I'm going to tell you that now. I beat you to telling. It tells on me. My body tells on me by snitching. So I'm going to tell on it by snitching on it, my body and stuff. I don't have to be uncomfortable. If I can find out what it is and stuff and then get to the bottom of it. Okay. So, hello, Miss Sandra. She said, hello, Nurse Charlene Allen, and good evening, Rosie. Rosie is on too, I believe. I haven't seen her yet, but she's on here. And so she's listening. All right, you guys, welcome on in. Welcome on in. I haven't even started the actual podcast yet because I wanted to give you a little quick brief of what's to come in the future. Now we're going to talk about sarcoidosis. I gotta say it slow. But I can get it out and everything. So what it is I gotta give you a definition, and I'll try to keep it, because this is layman's term. Oh, hello, Charlene. This is also T. Oh, welcome in, T. Thank you for coming on and stuff. Hopefully you could get something out of this and everything, but it's always something good coming and stuff. And anything you miss, go back and watch the replay at a better time and everything. But definitely come on in and have a listen. We got sarcoidosis and similar illnesses. So I'm going to talk about these because sometimes it deserves a little highlight so that you see what's actually going on, because it's really important. But if we never find out what the people have, just imagine me as a nurse coming, going on the floor. I get my assignment. I get 4 people that I may know, maybe 1 or 2 or something like that, and a couple I don't know. And they come in with something and they say that they got blah, 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 blah. I'm like, what is blah, blah, blah? I'm just like you. I'm just like the doctor. I don't know what blah, blah, blah is. What is that? Is that up top or up at the bottom? Where do I start? And stuff. So then you got to gather information. So doctors actually aren't nosy, neither are nurses. But for those of you that know me and have ever asked me a question like, I got a rash over here, or I got a bump right here, or something like that, and just want to get my opinion and stuff. Remember, I'll say, how long have you had it? And then I might ask you something like, has anybody else had this and stuff? Have you been around somebody, and stuff? That's gathering information. If a detective want to solve a murder, they got to ask the people, around and stuff. They got to find out, and stuff. So that's what this is all about. You got to find out what's going on. You can't just, oh girl, that's a so-and-so. That's the inflammation of your blah, blah, blah. And yeah, I don't know. I don't know. The doctor doesn't even know. So guess what? We're going to ask you questions. I got a hand tremor, and well, do you have a history of Parkinson? Because that tends to have that. Do you have a history of alcohol overuse or abuse, and everything? Because that can give you, if you're going through what they call the DTs or detoxing, from it and stuff, you can have those and stuff. So there's several different things that can happen from just that one thing. And so you got to gather the information. So going back to sarcoidosis, it's a chronic inflammatory disease in which the immune system overreacts. It's doing too much, forming these things called granulomas, which is tiny clumps of inflammatory cells, or your immune cells, the white blood cells that help you fight off infections. They clump together, forming these things called granulomas, and they kind of almost mimic cancer tumors. Yeah. So could you imagine that they see this big old tumor? Uh-oh, they got a lesion. It got to be cancer, and it's not. But it mimics it. It kind of look like it. They're gonna take a biopsy to try to find out, and stuff. But that's what it is. So forming these granulomas in various organs. That means it can happen at any part of your body. So your girl is a star artist and everything. So what do I got up there? Your lungs. And what is them big old dots? Big old, those are clumps called granulomas, because sarcoidosis can hit different things. So guess what? This one in the middle, you don't know until I tell you, but that's actually an eyeball. And that's the optic nerve. That's where the clumps hit. Right on that optic nerve, causing inflammation of your eye nerve or your optic nerve and everything. So you see where I'm going with this. So then right here, okay, nobody ankles is that big, but I had to make it big enough for you to see it. But what I'm trying to show you is that's somebody's knee down, to their foot. And then these little patches are the different patches of spots on there, which is another way of saying that sarcoidosis, it actually is a chronic inflammatory disease, but it touches these organs. Listen, lungs. So that's what my big old clumps, the granulomas are. The eye and stuff. So it's going to touch the eyeball and the optic nerve, and everything. And then also arms and legs. So I just put the legs. I couldn't put every single body part and stuff like that, but the arms and legs. But it touches it can touch any organ or attack any organ. Of course, the lungs being really serious, but also the skin, which is on the legs and the arms and stuff like that being serious, because you can see it. It's going to tell on itself because you can see big patches. But also it touches in the back of your eye. Leave my eyes alone or I'll be blind, or something like that. But it actually touches that, and stuff. But it touches, guess what? Your heart is an organ, so it can touch it. Your liver is an organ, so it can touch it. Your stomach is an organ. It can touch it. So you see where I'm going with this. Any organs, it can touch it. So you see how serious this is if you messed around and found out and got this, and everything. So it's worth a hearing of it, even if it doesn't touch you. It's not one size fits all, but it is educating you. And now you're in the know. Okay. So, one more thing, and it touches the lymph nodes. And if you've ever had a doctor's exam and stuff, and they go up under your arm and up under your like in your, what is this, under your chin and stuff, they're looking for your lymph nodes and stuff. And sometimes if they're swollen, it could tell if you got a cold or something. Welcome on in, Miss Charlene. I got to get you on here too, Miss Lady and stuff. She said, hello, family. All right. Welcome on in, my dear. And stuff. So those little different little spots on you and stuff like that. So the lymph nodes, that's responsible for your immune system, your lymph nodes and stuff. And so that's how you can tell if you got some type of infection in your body. They swell up. They engorge, and they're really painful, and you can touch them, especially under your neck. Well, I don't have any right now, but my lymph nodes are there. They're just not swollen, and I'm not infected with anything right now and stuff. So, but it can happen, and it has happened in the past because I'm a human being. Okay. And stuff. So, there are similar illnesses. So I want to make sure that I didn't just talk about this without saying other things to compare it to. And one is called TB, tuberculosis. I know everybody heard of that because you get that little yearly. If you got a job where you're in the healthcare field or even the schools and stuff, the kids got to get that little bubble under their arm and stuff like that, and they put that little juice or whatever, I don't know what it is and stuff, but in 3 days, you sit there, and if that thing swell up, you gonna mess around and find out something. But if it doesn't and it just goes away, maybe even the first day, 24 hours, and everything, then you know that you're not infected with TB yet, and stuff. But at any time we can get it from just anything and stuff. Welcome on in, Melissa. Long time no here, my dear. She said, let me see. She said, I have psoriasis, and that's an autoimmune disease that causes inflammation. Does that affect my organs too? Not actually the inner organs, but the skin is the organ. So yes, actually it does, affect that and everything and stuff. But that's one of my skin illnesses or disease processes and everything. And I also suffer from its big sister or big brother and stuff called eczema. And I didn't even know I had it for years, and it's been few and far between. But I used to get it like when it was really sunny in the summertime and stuff inside the inner elbows. And I was like, is that sunburn? And it was actually that. Yes. Oh, and your arthritis, absolutely. And I actually did a podcast on autoimmune diseases, and I talked about Graves' disease and different things. It's so many of them. I think it's like 200 of them. But arthritis, rheumatoid arthritis, and all of that, they all fall under autoimmune and stuff. So good job bringing that up, because that's going to be on the topic of back to the basics. So I'll definitely be talking about that in future podcasts and stuff. But thanks for that information. Auntie Josie said, okay. So we know viewers pick. She said, I had sarcoidosis since I was 28 years old. It attacked my lungs first, then it attacked my nostrils. Oh yes, because it's another part. I'm getting to that also and stuff. It's another part. It's called perennial lupus. So it's kind of lupusy, and everything and stuff. And it's crazy because this thing is more common than it's being said. And then it's so hard to pronounce it. Yes, and everything and stuff. But you said it attacks your nostrils twice. Then it attacks my liver. Yes. But I'm doing well so far. And I'm glad it's not attacking my organs. And it hasn't attacked my organs in a while. God is good. Absolutely. God is wonderful. And I thank you for that and stuff. Auntie Josie. That's why it's so important to talk about this, because that's a big deal and stuff. This is an actual person that had sarcoidosis, and it's actually something that's almost lifelong, unfortunately. But God is good, because if he could keep the flares to a minimum, then you can live a perfectly healthy life. The fatality, I'm gonna just tell you right now, so the fatality rate is lower. It is serious, 911 serious when it's happening and everything, but the rate of death is very low. It's 5 to 10% of most people that get it. So you would probably, go from something else than that and everything. But it is serious when you have it. And I'm gonna give you some good news about that, Auntie Josie. Also, Miss Terrellin said, let me see. What happens when one side of your nose burns and hurts? Well, it depends, if you're usually when something like that's happening, they call it sinusitis, which is your sinuses and inflammation of it. So one side or another, and it really burns and stuff. Sometimes people get it from it drying. Your mucous membranes inside your nose is drying and stuff. So it gets really, really bad, And then also another reason that it burns like that and stuff is allergens. Like you might be allergic to the dust that's in that part of the house or something. So it would behoove you to try to take put a mask on when cleaning, because if you notice it after you do something, or when you're in a certain part of your house, or you at the job and you doing a certain job, if you don't have that protective equipment on and stuff like that, it can do that. If you're around certain chemicals, your body might be hypersensitive to them and stuff like that, and so that's when that can happen and stuff. So definitely some good questions, you guys, and some good information also, and even a testimonial, because we're going to start doing testimonial Tuesdays. But this is some good stuff here. Similar diseases that do the same thing as sarcoidosis is tuberculosis. That's what I was telling you. And that's a bacterial infection that also causes granulomas. These are granulomas. This is a granuloma. That's a clump of white blood cells, which is your fighter cells, your killers. You know, when your body is being attacked and getting whooped and stuff, this is the one that you want to see about right here and stuff, because it can mimic cancer. So you like, oh, I got a lesion on here, or I got a lesion on there, and stuff. You like, what the heck is going on here? And it looks like it would be that, and everything. And so make no mistake, even though my drawings are cartoonish, this is your eyeball. And it attacks that nerve behind your eyeball. We all got this behind our eyeballs. That's serious. This is your lungs. Well, not your lungs, but my drawing of your lungs represent your lungs. It'll attack those big old clumps on there, the little circles. That's one of these and stuff. So, and it causes trouble. And it tears up and terrorizes that spot that it's in. These right here, make no mistake, it's not just, because you want to have pretty legs or something like that. These are actual patches of not eczema, not psoriasis, but this is a sarcoidosis, because it attacks organs. Your skin system is an organ. Your heart is an organ. Your lymph nodes is an organ. So it's attacking anything it can get to and get inside of. So it is a hot mess, and everything. And it causes trouble, lots of pain and trouble. So Pastor Carol said, wait, will it start burning? Yes, it can start burning and stuff. It's inflamed. So that's what you call burning and stuff. Absolutely. Good questions, you guys, and stuff. And so then we got Pastor Carol said, it will start burning in your nose. Absolutely. Maybe Josie, you could come on if you listening and stuff. Come on and tell us some of the symptoms, which means some of the things that it caused. Did it cause your nose to bleed? Did it cause it to run? Was it real dry and burning in there, and you might have had to put something in there and stuff? If you could come on and let me know what it did when it attacked your nose and stuff, that would be very helpful. And also, Miss Terrelyn said, my sister has that. Oh, see, exactly. So you see why this is good to talk about it, because you just never know. It might not fit you, but it might be somebody that you love, or it might be your neighbor that you care about, and stuff. But somehow this stuff is more common than not and everything. So that's where that comes in at. So like I said, one similar illness that mimics it and stuff is tuberculosis. There's a difference, and I'll tell you about that later and stuff. Also, it's one called hypersensitivity pneumonitis. That's about full, huh? Okay, so hypersensitivity. Hyper is too much, and sensitive is you're sensitive to it. You react to it and stuff. So hyper, too much reaction to it. You know what I'm saying? So that's part of it. And then pneumonitis. Pneumo always refers to your lungs, and itis is inflammation. So lung inflammation. So it is burning and everything. So Miss Terrelyn said, I have a bruise on my arm. It burns and it hurts bad. It was below my wrist. Wait, oh, below my wrist, and now it's almost to my shoulder. Okay, so that might be something else. That's something your body is snitching. So I might have to call you after after the live. But with that happening and stuff, you got to look out for some other things, like one called cellulitis and everything. So I would definitely complain to my doctor about that. It should not be traveling. That means it might be inside your blood system. So when stuff travels and it's at one place and then it starts moving its way up, there's a reaction because of something. Something caused that to react like that. And then if you sit there and you know, like you might put some cream on it or something like that and try to fix it and stuff like that, it won't fix it. So then you got to move on to the next thing, and that's one that I advise you as your sis and everything, and you know, we family and stuff, that you need to actually tell your doctor about that, because you don't want to have something like a septic event or some type of infection inside your blood system, because then that travels to some more places and then you're out of your mind and you can't even go tell on it because you're down, you know, and everything. So that's something, please get that checked out as soon as possible. And if not, message me or call me later and everything. Definitely, we got to talk. So Auntie Josie got back on the line and stuff, and she said my tissue was growing so fast I couldn't breathe. Very short of breath. Absolutely. And I'm getting to those symptoms in a minute and everything. But yeah, that's crazy. That's crazy and stuff. But she was saying, you know, with that nostril thing, it started burning so bad that you stop being able to breathe and stuff. You got to try to cool it off and stuff. You probably have to put cool compresses, but that's something worth telling the doctor, because anything that affects your breathing affects your life and everything. So definitely that's something to talk about. And Miss Carolyn said yours is below your elbow and everything. Yes, it's still, but you said it started at the wrist. It's still below the elbow, but it then traveled up to as far as maybe the elbow and everything. That means that it's moving around. It's not going to get better. It's going to get worse, and it's going to make its way up and stuff, and it's going to keep on traveling upwards because that's going closer to your heart. It started at your wrist, that's further away. It's a distance and stuff. So that's something that you definitely got to get checked out. Pastor Carol said, yes, bloodstream. Yes, pay and pray attention to that and stuff, definitely. And you said, oh, right, they gave you cream, so they know, but they gave you some cream for it, but is that all? Are they aware that it had started to travel? Because you may have to still tell them, stay on it, no matter what, stay on it and everything. You said you've been telling them. Okay. And they're not, oh my God. Yeah, everybody thinks Kaiser is the truth and the light. They can be, they're convenient and stuff, but they're more of get you in, get you out, and they get ahead. You don't, you know, and everything and stuff. If they don't listen, make them. You can make them. You can put demands on it. You can threaten to call, you know, joint commission on them. I call the state on you. Y'all better do something about this, because it's no joke. And what happens is you end up losing your arm, and they're like, well, she didn't tell me all of this was happening. Or, you know, it's always going to be blamed back on you. And you know what I'm saying? Like I said, I can't help you with your lawsuit, but I hope you win if you're doing it in good faith. This will be a good faith method right here and stuff. But I'm telling you, you stay on it, because they're not in your skin. So they don't know how bad it burns. They don't know it might keep you up at night. They don't know this and stuff. So you got to make them know it. And then this is even worse. February, so March, April, May, June, July, August, September, October. Yeah, that's 8 months. Yeah, that's too long. You shouldn't be suffering for 8 months. You should have had a reprieve or relief in between there. If they did not do nothing to relieve you, they're failing you. And then I would go start getting second opinions. Change your doctor. If they're not paying attention, get somebody that will and stuff. Definitely and stuff. Oh, Pastor Carol said you definitely know that wasn't there. Okay, yes, and stuff. So if you know that wasn't there before and stuff, and it's there now and stuff, yeah, that's something you got to pay attention, because if you don't speak up for you, who will? There, nobody's inside of you. Even your precious sons, and stuff that love you, they want you to stay here. Your grandsons and everybody else that love you and stuff want you to stay here, and the only person that's going to be able to advocate the best for you, because you're experiencing it, is you and stuff. So definitely, you said I made a call and complain. Keep on complaining until they pay attention, because now it's on paper. So there's a paper trail. So when they mess up and something ends up happening or something like that, then they're liable. They're liable, absolutely, and everything. And you said I have record. Trust me. I know that's right. And so trust you're right and stuff, because you're the only one. That's you. And guess what? You the only one get that arm, and everything. You'll never get that arm back, and everything. They got all these electronic arms and bionic arms and stuff, but you'll never get your arm back that you was born with and stuff like that. So yeah, you got to keep on, stay on it. I promise you, there's a light at the end of the tunnel, and you will get what you need and everything. But you got to keep them complaints going. They got to get sick of you. They got to get sick of you and everything. So just going back to the sarcoidosis, the causes, they said they're unknown. Why do you get this? It's unknown, actually. They can't say. It's because you got black hair and brown eyes, and stuff. It's not that easy and everything and stuff. But some of the causes, they involve genetic, family history. So the doctor not nosy if he know grandma and grandpa had it. If he know that your sister or your brother had it, your father on your auntie on your father's side had it, or your auntie on your mama's side had it, or something like that and stuff. That's not too far from. Give them the information so you can get healed and get fixed and everything and stuff. Sometimes it's an abnormal immune response. Your body is always trying to fight off foreign invaders. It don't want no strangers up in its house and stuff, like our vaccines and all of that stuff. So it's trying to fight these people off and everything and stuff. So that's what that comes in at. Auntie Jolie said, I'm not good with the iPad, so I speak to everyone, but I do have a lot to say about my experience. Absolutely and stuff. And I know that even if you're not good with the iPad, writing it down, good old fashioned pen and paper, that ain't never hurt nobody. If you can't, put it into words or type it on, with your little thumbs trying to get on there and type all them words out and stuff, write it down first, and then you can type it in and take your time and stuff. So that's definitely something that you could do. But good work, Josie and stuff. And Carolyn was like, right and stuff. Yeah, you your best advocate, no matter what and everything. Everybody might love you and stuff, but you the only one suffering with it inside your body, inside your, whatever it is, your arm, your leg, your nose, your head, those headaches, those skin attacks, that burning at night and stuff. You can't sleep because it's burning or aching. I be having stuff burning and aching and, different things, itching. I always talk about itching, but I'm saying all of this to say that, it's serious. Abnormal immune response, possible links to sarcoidosis in general is infections, dust exposure. Do you know you can be allergic to dust? My doctor told me about that a long time ago, before I was even a nurse and stuff. And I was like, that doesn't make sense. How are you gonna be allergic to dust? Dust is just floating around. Like I never understood that. But you can actually be in an environment where it's too dusty and everything. If you haven't been in that living room in that corner for a long time, you best to believe it's some dust over there and everything. And you better put on a mask, or you gonna mess around and find out like I did plenty of time after I'm choking, and I'm just saying, I'm just saying, it happens and stuff. So those things, occupational hazards, like the janitor messing with chemicals, or the nurse on the oncology floor, cancer floor, walking in the wrong room and stuff, and chemotherapy is being had in that area and stuff like that. And I don't have the right equipment on, protective equipment and everything. So it's called personal protective equipment, PPE, and everything. But those things, also other causes of the granuloma right here and stuff is TB, like a fungal infection, those infectious organisms and stuff, bacterium, because it's called mycobacterium tuberculosis. And then sensitivity to birds and bird droppings. So staying away from them birds and stuff in that pole. You see all of the poo-poo on the ground. Don't walk under it, and stuff. That bird stuff get on you, and the next thing you know, you in the hospital. And it ain't cute, like, oh, the bird dookied on me. Yeah, and then you in the hospital because you're allergic to whatever is in that dropping, and stuff. That's where they had bird flu, swine flu, and all of that. Yeah, I'm just saying and stuff. And the industrial exposures would be those chemicals that a janitor uses, or that you use at home. Pine Sol and all of that. We're supposed to actually with bleach and Pine Sol, we actually supposed to have gloves on. Who hasn't used gloves and cleaned up their house and wiped their counters down with some type of Clorox cleanup or bleach or Mr. Clean or whatever? Bam! I have. Yeah. Hooray for me, huh? No, I just poisoned myself. But that counter is clean, huh? Yeah. The counters don't get poisoned, but I do. My skin, it has pores and it can seep inside. That's why your nails get weak or something like that. If you are constantly washing something and you don't put those gloves on. Dawn dishwashing liquid, it's a chemical. Yeah, that's why it gets the grease out of the way, okay. But anyway, I'm just saying. Symptoms. These are generalized symptoms of sarcoidosis. And that would be fatigue. I'm tired. I just don't have no strength left. Fever. It's 100 now. It's 102. 102.9. And it ain't KBLX, or something like that. And so different things like that. Weight loss. Don't sleep on weight loss. Did you try to lose weight, or you just drop some pounds quick and stuff? To pay attention and pray attention. Yes, Miss Terrellin said, have them gloves on now. Yes, absolutely. Go to that Dollar Tree and get you some of them little yellow gloves. You wonder why Alice from the Brady Bunch had her little thing on when she getting ready to mop the floor and stuff, because we not supposed to be touching the Pine Sol and all of that stuff. Yes. Welcome on in, my niece Whitney. She said, love this. Thanks for always giving us better ways to stay healthy. Absolutely. I appreciate you for coming on and learning a little something else that you didn't know maybe the day before, yesterday. Now you know today and stuff. But thank you for coming on and stuff. Also, similar symptoms, like I told you, similar illnesses like TB. A hallmark of TB, which is the lung bacterial infection in your lungs, and it's very contagious, highly contagious, is a cough or bloody sputum. So guess what sputum is? My mother had it. Y'all might laugh and stuff. My mother called it kafooey. You called it kafooey, but that, and stuff, and that lump of green or yellow or something like that, showing that you actually got a infection. It'd usually be a lump of that with some blood in it if you got TB, and stuff. So that's how serious it is. You don't want your lungs bleeding. That's your air center. That's you don't breathe, you die. So if your lungs is all messed up and inflamed and you bleeding and stuff like that, that's a problem. That's 911 and everything and stuff. But that, and like I said, the weight loss and stuff, the hypersensitivity, that's when it's doing too much and it's sensitive to it, and it's your lungs are inflamed and stuff. You get a recurrent cough. Oh, you just can't get rid of that itchy cough, that pesky cough. You just cough for no reason. You just walking down the street, you feeling good, and bam, you yeah, it's not good. It's something worth telling on. At least that. And if you look at that, the airway, the airway, breathing, and circulation are your ABCs and stuff, or circulation would be blood. If you bleeding too much, you probably gonna lose. You ain't got that much in you, and so you got a little something. But if you bleeding like that and stuff, and it don't stop, and you can't apply pressure and make that thing stop, that's a problem. You're not gonna be here too much longer, and stuff, and so on and so forth. So that's why just paying attention to these things, how they diagnose it and stuff. Any of them, TB or all of them and stuff. Well, TB, we know they put that little juice in your arm or the little kid's arm and stuff and give them a TB time test, they call it, and everything. And then you read it 3 days later, and stuff like that. And if you come across something, even coming across somebody else that had active TB and you didn't actually get the actual TB, now you have to be surveillance, you have to be watched and stuff so that you don't actually convert into actual like diabetes, converting into diabetes, pre-diabetes, converting into diabetes. This is a TB-ish converting into actual TB, and everything and stuff. So then also it's a chest x-ray or a CT scan when they say they scanning you, and stuff like that. And it shows up as enlarged lymph nodes. Remember, I told you the lymph nodes are here, but they're under your underarms. They're all over your body and stuff. And, they're a big deal because they're your immune response and your immune system. It shows up as lung nodules on the x-ray and different things like that. Usually they have to take a biopsy if it's sarcoidosis. They take a biopsy and it confirms a granuloma and everything. And then there's blood tests also, like if you come back and you have a high calcium level, that might be an indicator that there's some trouble. And then there's another one called the ACE, or angiotensin converting enzyme. Don't worry about that. It's ACE and stuff, but it'll come back as elevated or up, higher than the number. If they give you it's 1 through 10 and you are 15, you probably got to elevate it, whatever it is, and stuff like that. That's where that comes from. So Auntie Josie put something down. I did have I did have a fever of 105 and broke out with a rash all over my body and couldn't walk a flight of stairs. And one time I had a doctor's appointment and I was talking to the doctor, and he told me I couldn't go home because my white blood cells were taking over my red blood cells. So I was glad that I'm doing well. Absolutely, because you can recover from it and stuff. You can recover from it, but like you said, the white blood cells, they try so hard that they clump up and they call them granulomas. It's all your fighter cells. If you don't have enough fighter cells, or you have too many fighter cells because they had to replicate themselves so that they can get to this big old infection that we call sarcoidosis and stuff, then you were in trouble. So it was trying to help you, but then it overdid it. It overhelped. So now it's leaving you with scar tissue on your lungs or scar tissue on your eye nerves and stuff like that, inflammation of your nerve of your eyes. So then your eyes are all bloody red and and even swollen and all of these different things. You're having headaches because your eyes are, it's messing with your optic nerves and stuff. You can't see, everything gets blurry. Yeah, it's bad and everything. So Miss Terrelyn said, I have a 5 millimeter one on my lungs that's going to check it in 12 months. Absolutely. And you got to go back in that 12 months to make sure that thing either is dissipating or it's staying stagnant, or what, almost like benign, like it ain't moving, it's not getting bigger, it's not shape shifting into something else or something like that and stuff. You want to make sure that you're staying on top of it. Once they tell you that they need to look at it, let them look at it. It's the difference between catching something at a stage 1 or 0 to 1 or a stage 4 or 5, even and stuff like that. So you got to stay on it. If they tell you that, you got to stay on it and everything. It's very important and stuff. Good work, you guys and stuff. Y'all putting in this work and stuff. I like this. It was 3 and now it's 5. So it is growing. So make sure that you stay on that with them and stuff. And if it's doing any symptoms that is not right, you need to tell on it even faster than that and everything, and have them check it even sooner than 12 months. Because if it went from a 3 to a 5, that's actually a problem. That means it's getting bigger. So whatever it was trying to solve hasn't been solved yet, because the number wouldn't be going up. If it's going up, that means it's getting bigger. And we're talking about a little tiny spot, but it's getting bigger. That means that it's found a way to grow and replicate in that little area. So one of these is a couple clumps together and stuff like that. Absolutely. Yes, ma'am. Miss Terrelyn said she's getting out of Kaiser. Yes, yes, yes. And not because Kaiser might work for other people, and it might work for most, and stuff. But when it stopped working, go to what works. Go to somebody that's hungry for work, and stuff, that want to actually do some work when they come in, because that's the one that's gonna get you to the better side of things and everything. And make sure that you stay on that, Terrelyn. I'm serious. You got to stay on that and stuff, because it's other things that you might be missing that's causing more and more things. Yes, they're not cool and stuff. Definitely. It's this is what's happening. But I just want to stop for a second and say, you see what I'm talking about, you guys, and stuff. This sarcoidosis, you probably never heard of it before, because I never heard of it but a couple times in the past, actually, kind of years ago and stuff, heard about somebody getting this. And if you can imagine that and stuff like that, so it's worth me coming on here doing a live on it, because it's serious and people are suffering. Your everyday people, your family, we are from the Bay Area and stuff, that's getting on here and stuff like that, and we're actually suffering and stuff. So this is a big deal, and definitely something that needs to be discussed and stuff. So I'm glad I'm one of the first that's bursting a bubble and discussing it and everything. Miss Sandra said, no need to leave Kaiser, just get another doctor. Okay, so this is another Miss Terrelyn. This is another person. Sandra said, no need to leave Kaiser, just get another doctor. Yes, you can change your doctors until you get one that fits. But okay. Let me go ahead and address this real quick. This is what I do. 21 years in nursing and stuff. It's not for nothing. It's because I had to mess around and find out one way or another, or I found out right along with the patient and everything. But she said I was having trouble breathing, and the doctor was trying to give me Benadryl. He must have thought she was having an allergic reaction, because that's the only time they would give a Benadryl, as opposed to like a steroid like prednisone. You probably had some of that too, actually. But they have that when they do breathing treatments for asthma and stuff like that. They, that albuterol and stuff, and they have another steroid and stuff that they use in those little puffers and stuff like that. So that's one way. And another thing was, Charlene said her sister have it. So yes, it's genetic. So you see what I'm talking about? The doctor not being nosy if he find out that your sister or your brother has it, or your grandmother or grandfather had it, or your uncle on your dad's side, or auntie on your dad's side, or your or whatever and stuff like that. Tell. Stop holding it in and stuff. What you holding it in, you're not gonna get cured. You're not gonna get fixed, and stuff like that. So that's where that comes in at. And they all worked. Oh, would you say they all work together? My doctor, cool. It's the ones she's sending me to. Oh, the specialist. Yeah. Keep on going to keep getting her to send you to another one. If that one is not solved, it's and stuff. But complain to your doctor. If you found a friend in your actual doctor, complain to your doctor until y'all get to the bottom of it. She might have to overstep and go over there and find out, why are you guys not taking care of my patient? I sent them to you because this is what you specialize in. So help her, help her so that she can help herself, and everything. So that makes sense and stuff. So then Carolyn also said, nope, I didn't take it. I have my inhaler. That's good and stuff. So some things and everything, but definitely follow your instinct, because like I said, them is your lungs. You know how much you can breathe and what you can't breathe and everything. So oh, well, you might be able to show it to her and stuff. You can do the replay and stuff. Miss Carolyn said that she wish her doctor could hear this and everything. Yes, show her the replay and stuff, because this is just plain old medical talk. Definitely in layman's terms, because we're talking about that. But you said, yes, I went outside of Kaiser. Absolutely. If that's what it takes. Because it's always somebody that's hungry to actually do the job that they've been born to do, that they were blessed to get the education for. Somebody gonna use their head. Somebody gonna use their education and get you to the better side and stuff. Somebody, instead of just showing up for a paycheck. And we got to start making them work too, though. It's our fault too, because we got to make them work. If I'm sitting up here with insurance and I never go to the doctor, because I have did that. Don't get me wrong. That's why I'm telling you now and stuff, because I did it already. I made that mistake already of not going to the doctor. And then when I really need everything and everything coming down on my head and stuff, I don't have a doctor for it. I don't have the insurance no more for that. Or I don't have this, or they don't pay for that anymore. And then I'm like, braces. They give you a one time, you get so many thousands of dollars, for your braces and everything. And then you never go get your teeth fixed. And then you lose the insurance and you want your teeth fixed. Yeah, you just fresh out of that option. You better come up with some ducats. You see what I'm saying? So it's just little things like that. Tell. Complain. Switch doctors. If this one ain't working, they don't want their money and stuff, I'll find one that do. Somebody hungry, or somebody is skilled enough that maybe you just not skilled in that area and stuff. So maybe you not going to be the help for me, but somebody will and stuff. Keep on making the complaints. Stay on it. You might be the one that helped all of us on here. And then you can come back and do Testimonial Tuesday and tell me. Okay. All right. So I know some of you guys got to get off and go on to a Bible study, and that is totally fine. I do not compete with the Lord, but make sure you go back when you get a chance and watch the replay for anything that you missed. I'm going to be getting off in about 10 minutes and everything, but saying all of this to say that thank you for coming on. Thank you for participating. God bless you, and I'll see you again on next Tuesday. All right, so going back to sarcoidosis and the treatment. Many cases Auntie Josie, many cases resolve spontaneously, meaning no treatment. They just resolve themselves and stuff. But just in case they don't, let me see. Just in case they don't, you need to make sure that you're in there and you're complaining about every single thing, even if it's something insignificant, it's small, but it's still bothering you and stuff. Tell on everything and stuff, and and stuff. That's how you're gonna take care of yourself. You only get one you and stuff. There's also steroids like prednisone, and that's their first line and stuff. Like I was telling Sister Charlene and stuff about first line of defense is a steroid and stuff, and it's prednisone. And I know everybody heard of that and stuff, but it actually helps and everything. So then they got also immunosuppressive drugs and stuff, different drugs. It's no sense of me telling you what they are because some people might know and stuff that's experienced it, like Auntie Josie and stuff. And that was if you've ever heard of Auntie Josie of methotrexate and different things like that. And there's one called hydroxychloroquine and stuff like that. Those are some other medicines they may use for it and everything, but it's different ones for different things. Also, oxygen support. They may have to put you on oxygen with one of those humidifiers with the little moist tricklets so that you don't burn out your nose, getting the oxygen to help you breathe better. But then you need the little humidifier so that it's moist air going in and stuff, so it's not tearing down your nose and all the drying out your nose and stuff while giving you the oxygen that you really need. Then you got nosebleeds and burning and all of that stuff and everything. Different things. So I want to do some myth and a take-home message. Myth versus facts. Myth, or not the truth. Sarcoidosis is contagious. That is not true. It is not contagious. It's genetic. So you might catch it from your grandma, catch it from your grandpa or something like that and stuff. It's not contagious. It's actually, in fact, the only thing that's contagious is your TB and stuff and other hypersensitive things like that that come out of other similar illnesses. But it's not actual sarcoidosis. Is that's gonna be with you and everything, or anybody that has that same gene and everything. It skips over different generations and stuff like that, but you could get it that way and stuff, but not I sneeze on you and now you got it, or I rub up against you and I'm in my flare up. Yeah, you don't get it that way. It's not infectious. Only the lungs are infected by sarcoidosis. Well, we found out it's multiple organs. It's your lungs, but it's also your optic nerve. It's also the skin is an organ, your heart, your lymph nodes are organ, organ system, and so on, your stomach, your liver, and all those things and stuff. So that is true and stuff. Benny Max passed away from sarcoidosis due to his lungs, but they say more women get it than men. That's correct. You just said what I was about to say at my end and stuff, because I'm about to finish off and everything and stuff. But yeah, Beanie Man actually got this, and that's what he passed away of and everything. And it's just so sudden the way it comes on, but it is genetic. It's genetic first. That's the first line. Is anybody else in your family got it, and stuff like that. But if you never took the time to find out and stuff, then you get it and stuff, and then it starts with you and everything. But it's definitely worth finding out and stuff, was that in my gene pool and everything, because they don't have an actual let me see. They don't have an actual what is it called? Where it's of unknown origin. Like it begins, they don't know what causes you to get it or get that flare up in the first place. So that's a big deal and everything. So then of course, it's not true that only the lungs are infected. That's in fact, it involves your eyes, your skin, your heart, your nerve system, you guys, your liver, your spleen, and all the other good stuff, that we make up as a human being. Um, Sarcoidosis always requires treatment. That's not true. The fact is up to 60% resolve without treatment and everything. 60%. So if it's 100, only 40% of you guys are going to have medicines and different things for, a course of medicine for a minute and everything to get, better and everything. And then, like I said, it is fatal. So make no mistake, but it's usually 5 to 10%. And that's usually a lung or heart attack on it, sarcoidosis on your heart or on your lungs and stuff. And yes, your heart is your engine of your body. It pumps so that you keep going. And then your lungs is your airway of your body. So that's also the engine of your body and stuff. And if we don't breathe, we don't live. If your heart doesn't beat, you don't live. So you see why, and those are the people that pass away of it. And it's usually a 5 to 10% of them. So it's a very low percentage of people that pass away from it. But you will be, affected lifelong. You just want to keep the flare-ups to a minimum. And that's what just going to the doctor, telling on things and stuff, because you could catch it before. Early detection is always best detection. So then my take-home message, and then I'm going to be leaving you guys until next Tuesday. And that is sarcoidosis is a multi-system. Multi-system. That means it can affect your lungs, your heart, your liver, your kidneys, anything that's an organ. Your skin is an organ and everything and stuff. So multi-system inflammatory disease of unknown cause, characterized by granulomas. That's my granulomas. Also, similar diseases like TB, which is fungal and contagious, highly contagious, and hypersensitivity pneumonitis, which is a turn up to inflammation of your lungs. You just oversensitive and stuff is happening. Welcome in, Brittany. I'm glad you came on, baby. And proper diagnosis is crucial to avoid mistreatment. For example, giving steroids to somebody with TB, excuse me, can worsen their TB, and make them more sick when you're trying to treat sarcoidosis and they actually got TB. But I said it's similar, but they're not the same and everything. So then treatment ranges from observation to steroids. I see what you said, Josie, to steroids. And also immunodepressants. That means your immune system, it kind of calms the immune system down so that it's not overdoing white blood cells. Like Josie said in her testimonial and stuff, that the white blood cells was taking over the red blood cells. That means she had too many. That means she was highly infectious to herself. Her body was over immune, her immunity was so high that it was getting her sicker, than she already was from it. It was trying to help, but it was helping and jacking things up. And then it leaves a scar and stuff. So you're not helping if you overdoing it. Don't overwar, don't nuke the whole area and then the whole host dies, and stuff like that. Just get what we need and be cool and stand down and everything. Yeah. Okay. And stuff. And then awareness and early diagnosis improves outcome and prevents complication. Lungs and lung fibrosis, blindness, and heart failure are some of the complications from having sarcoidosis. Okay, so I'm gonna end it with that, you guys. thank you for coming through. And I know that a lot of people didn't know what this is, and a lot of people had similar things and stuff. But the whole point of this is if we let it out into the airwaves and everything, you have time to go back and look at this, because this live was broadcasting uh, live and on YouTube as well as Facebook Live, and at the same time and stuff. So you could go back and look at it on YouTube under Medical Talk and Layman's Terms of Nurse Charlene, and then also in on Facebook Live and stuff. You'll see me, and stuff if you're my friend, or it's public, so you can see me that way also. Welcome on in, Miss Kathy. Thank you. She said wonderful information and stuff. I appreciate that. Yes. And definitely this was something worth talking about, because just because it might seem like the subject is hard, cancer is hard to talk about, diabetes is hard to talk about. So there's nothing that's easy to talk about, because they don't do easy things when they tear your body up, and everything. So the whole thing is, let's get the message out and let's get educated so that we can spot things before the trouble, kicks in and ensues and everything and stuff. Welcome on in. Raymond Buckner, my dad and stuff. He said, good to know and stuff. I appreciate you for coming on. Anything you missed, anybody that missed anything and stuff, go back and watch the replays. It'll be available a couple minutes after I get off of live and stuff, but it's definitely worth a listen, and everything. And like we said, it's a podcast, it's interactive, but if you didn't get a chance to interact and stuff, that's okay. Just go back and get the information, because it's still good, and you might help somebody else and save them by accident. But when you want to know that, and everything, then you don't have to panic with them. They panicking, you panicking. Well, who helping, and stuff like that. So that's where that comes in at. And Auntie Josie said, thank you for all the good information. If you want to talk to me about more about the information, please come. Absolutely. Yes, ma'am. I sure will. Yes, I appreciate you and stuff. And thanks for the topic and stuff. It was wonderful. And I had fun looking it up and stuff and researching it, because I always research before. And one thing before I leave off is, your body is a snitch. Believe it. And now I'm signing off, you guys. Y'all take care, okay?